Okay. Welcome to everyone who's joined us this evening. We are so grateful that you've taken the time to listen to our webinar, and we are thankful to have you listen in to what we have to say on all things about the egg donor process and a little bit about our financial plans. My name is Olivia. I'm the Physician Relations Specialist for Donor Egg Bank USA, and joining us is Margarita and Lindsay. They are the heads of our donor team. And I will say that if you have any questions, feel free to submit them in the Q&A. It is completely anonymous for you, and we will address them at the end. And I will hand it off to Lindsay and Margarita.
Thank you, Olivia, for the warm welcome. And thank you for everyone else who has joined us this evening. So let's start off where do we get our donors that are on our website? So all of our donors are recruited and screened by Donor Egg Bank USA partnered fertility clinics. All of the clinics are FDA registered, and many of them are licensed with additional jurisdictions such as New York, California, Canada, and others. So don't worry, if you have indicated that you are receiving care within one of those jurisdictions, you should only see those donors that pertain and are allowed to go there. Each fertility clinic is responsible for determining eligibility, and that includes the screening, the recruitment, everything that entails that Lindsay will share with you. Donors are between the ages of 21 and 28. For repeat donors, we go up to the age of 32. So Lindsay herself has had the opportunity to actually meet in person with donors at one of our partner fertility clinics. Lindsay, do you want to take it away and give your insight as to why donors actually are touched to donate?
Sure. So thank you everyone for joining us. And just want to reiterate again, if you have questions, feel free to drop those in the Q&A and we'll get to those once we've finished with the presentation. As Margarita said, I have been a donor coordinator within a fertility clinic, so I've had the privilege of working directly with donors. And I want to say that in my experience in doing that, I was often fascinated by the diverse and unique reasons why all of these women came to the clinic to decide to be a donor. Most donors come to the conclusion that they want to donate for altruistic reasons. Many of these women have experienced or seen infertility or a challenge to grow a family, whether that's through one of their family members or through a close friend. Perhaps a family member or a friend have had a difficult time conceiving. Perhaps the donor or a loved one are a member of the LGBTQ community. And in those cases, those individuals sometimes will need help of a donor and often want to pay it forward to be a donor to continue that cycle of giving. I had the privilege of once working with a donor who was married to a man who had been adopted, and he was so grateful for the family he had been adopted by. And together they had decided that they wanted to grow their family by adopting a child with a disability. And because that was their path to parenthood, they both wanted to become donors to help another family grow. I've even encountered donors who are very pragmatic about it and will say, well, I donate blood, so why wouldn't I donate an egg? Others still are mothers or stepmothers or aunts, and they believe so much in the passion and the love of a family that they choose to become a donor because they want to encourage others to continue to grow. I'd be remiss if we didn't discuss that some applicants do come to the decision that they want to donate because of the compensation. Although financial compensation can be a motivation for donors, in my experience, once they meet at the clinic and realize that they don't get to show up one day and receive a financial benefit the next, they will self-select themselves out of the program.
And that's okay. Egg donation is not for everyone.
Yeah. And I will say the robust screening process, which we'll talk about in a little bit, does encourage and enlighten the donors to the beauty of egg donation. It empowers them to learn more about themselves, to look deep within themselves, and then turn that around to help another family. And again, on the compensation note, many of these women are young. They're starting their lives. They may be supporting themselves through academics, whether that be, pursuing college or maybe a trade. Some are starting their families or aiming to support their families. And, they will often say that there's no opportunity like it where you can help another family and have a financial benefit for yours. So I definitely encourage you to check out the donor database. Every donor does list why she is motivated to become a donor, and many of them are very candid in how they would use their compensation or what brought them to this process. So we have some lovely examples of some responses from donors. The first donor said that she loves being a parent. She can't imagine not having her kids. She thinks that she's lucky that she's a parent, and she understands that not everyone has the experience that she had, and she just wants so badly to contribute that joy to someone else. Another donor had responded and said she has a close friend with infertility. She herself doesn't have a desire to have children, so it seemed unfair to her, so she became a donor.
And these are just these are quotes out of donor profiles. So I do recommend the donor motivations are something at least I even connect with. I feel like I'm able to say, wow, this donor, she's doing it for the right reasons. And I feel like there's a personal connection when you look at the profiles. And you can see their abilities, their skill set, their goals. You can read that between the lines. Yeah.
Yep. It's amazing what you can
collect
from just one response in black and white on the website. Some of them really will give you cold chills, and you just can tell that that's a donor that you connect with. So highly encourage you to check out that motivations tab. So the motivations is pretty much what gets the donor into our system and considering for, that she wants to begin the screening process. So what's the screening process like? All potential donors start at same square one. They've decided that they would like to apply, and they find our partner that's in their region, and they complete a comprehensive donor profile with a family history. That family history includes a multi-generational family history. So it's not only the donor, but it's the donor and 3 generations of her family. So her siblings, her parents, her grandparents, aunts, uncles, cousins, the whole big family. We work with both the clinic to review, so that is all self-reported by the donor. And then once the donor completes that, she gets to come into the clinic for a review with a coordinator or some of the clinic staff. So they review all of that history. And then here at Donor Egg Bank USA, we have a team of genetic counselors who help us review that multifamily history, because we're looking for any history that could be indicative that there may be a genetic risk in the family. So our goal is to reduce risk of a heritable disease. So whatever we identify, we're able to screen out with the help of our genetic counselors. Kind of going hand in hand with that, we look at the family medical history, but that's not everything. We also do genetic carrier testing for all of the donors. So that's an expanded panel to determine if the donor is a carrier of any genetic diseases. So that's great for our clients who often have also had their own genetic carrier testing. So you can easily view that on our website to see if our donors are a good match for you genetically. The next screening steps that are on there, at this point, the donor really can complete them in whatever order. Every donor completes all of them, but it's really what works best with her schedule as she's continuing to visit the clinic to complete all of these requirements and the available of all of the professionals who guide her through this process. So one step is the medical history review and her fertility health assessment. So that donor medical history review is a physical exam. So we've already looked at 3 generations of her family. We've done some genetic testing through that expanded panel, but we also want to take a look at the donor and confirm that she is indeed healthy, because that's something that she's going to contribute to the child that results from her donation. And also we care about the donor and want to make sure that she's in a good place in her life to be a donor. During that time, we're also doing a fertility health assessment. So it's a blood test and an ultrasound of her ovaries to make sure that she's a good candidate for donation. Not every woman who would apply for this would have the fertility markers or the baselines that we would see to be successful in a donor.
So we had a good question come through, Lindsay, and I just want, because we're touching on the topic,
Mhm.
how do we verify the family history? And I think you touched on a good point about we work with our genetic counselors. Can you elaborate more on that, just to give more information?
Sure. So we often get this question, how do you verify? And it's not that we're pulling medical records from every doctor's office or every hospital that has ever seen the donor or anyone in her family, but it's a series of interviews. So for one, donors don't know what we screen out for. They don't know what we consider as disqualifying or so we start with the donor just does a self-reporting of her family medical history. So she's going to do a nice long questionnaire for us that covers everything from asthma and psoriasis and allergies all the way through the big stuff, cancer and Alzheimer's. And we're asking about every single family member. If a donor comes back to us and gives us that full family medical history review and it's blank, we are certainly going to say, are you sure? Have you talked to everybody in your family? Grandma doesn't even have arthritis. And so we kind of repeat this process. So the donor self-reports the first time, then she's going to come into the clinic and she's going to report it again. And then she's going to go on and complete a further review with a genetic counselor. So at all these times, we're asking the donor to re-verify all of this information. We also do a psychological evaluation with the donors, in which case they're again reviewing family medical history, not only just the physical things that we think of most commonly, but also mental health disorders. So it's re-evaluated and discussed with the donor on several occasions beyond when she first self-reports that information.
Yep. So actually, let's move on to what disqualifies a donor, because I think that's important to highlight. They're like a needle in a haystack. When we think of this comprehensive process, I do think that those who end up donating the eggs, we are not just working with the donors who have committed to go through the full process, but have passed the screening process.
Mm-hmm. And are able to answer the questions, when requested, or if they don't know the information, tell us, I'm going to reach out to a family member and I'm going to get back to you on that information. So we do screen out donors at every single stage of the screening process. An overwhelming majority, so 57%, are actually screened out in that comprehensive profile. And that can be anything from the donor's personal history, her body mass index, her family history. So that's going back to something she may have reported in her family medical history that is something that we would screen out for as an increased risk. Perhaps she has a lack of childhood photos or inadequate photos for us to be able to display to a client so that they can get a good impression or feel for the donor or be able to see her physical characteristics. Another 19% of donors are not suitable based off of that fertility assessment. So that's some blood work for their hormones as well as an ultrasound of their ovaries to make sure they're suitable for donation. 8% of donors screen out due to their genetic carrier status, although almost everybody in the population, we're all a little bit genetically flawed and we carry something. So most of those are acceptable. We just want to make sure that everyone has compatible results. So I highly recommend anytime you're considering a donor, make sure to check with your physician that the genetics are a good match. But there are some select few genetic carrier statuses that we do not accept in our program and you won't see in our catalog. 2% of donors actually are screened out during that psychological evaluation. So that's some psychological testing and an interview with a certified psychologist. And that psychologist completes this whole evaluation according to recommendations from the American Society for Reproductive Medicine. And only 1% of donors are screened out for infectious disease blood work. So that's blood work that's required by the Food and Drug Administration for donors to complete in order to be a donor. So only 5% of donors actually make it from application to donation. You may see we haven't accounted for about 8% in there, and about 8% of donors may self-select themselves out of the process. Perhaps we asked too many questions about that family medical history that they weren't able to provide adequate information for, and they just decided that they weren't able to move forward, or maybe they just decided it wasn't the right time in their life.
It's a huge commitment. I see another question coming through. how much do donors receive? So I think there isn't a straight answer for that because it varies per fertility clinic. Again, depending on where the fertility clinic is, it can vary between $4,000 to $7,000, and sometimes donors get compensated a little bit more if they go into their second or third cycle. It varies, but I wouldn't say it goes over. I would say an average highest 8,000.
Yeah, the average you'll see, and again, like Margarita said, it kind of depends on region and cost of living in that area, starting around 4,000, 4,500 to about 8,000, which is the highest cap we usually see.
All right, so I'd like to talk to you about donor anonymity. This is something that, in my experience, when I used to work with intended parents, that wasn't a topic that first came to mind. And I think it's important to define the levels of donor anonymity because while there's not a lot of thought put into it right now, but it could be important to you for your child in the future. So we have two types of donor anonymity. It's non-disclosure, which is about 65% of our 65% of our database, and 35% is ID disclosure. So non-disclosure means that the donor consented that at the time of donation that she would only share identifying information that pertains to her profile, meaning her photos, her motivations, her work history, but she is not sharing more than just that. Then the 35% that I mentioned of ID disclosure, this is for, she signed at the time of donation that should there be a conceived donor child and they reach the majority of the age, they are willing to share their information. Again, the intended parent is still anonymous, and so is the donor to each other. But this is only for in the case that you decide to disclose to your child that they were donor conceived, and then they can reach out to Donor Egg Bank USA to request that information. So just have it in mind. All right, so again, we encourage you to take a look at our donor catalog. Within our donor catalog, so that 5% that we mentioned, you know that we work very hard to be able to help provide a diverse database. We will display the donor's physical characteristics along with her photos, both childhood and adult photos, her education, her skills and abilities, motivations, and a copy of her genetic family history and the genetic results, the genetic carrier results.
I think we did have one question in the Q&A that I think is a little bit along the lines of that genetic family history. So I thought I would go ahead and answer it while we're here. The question was, I noticed that some donors enable the visibility of their medical history and their fertility health, and some do not. What I want to point out there is that as we have evolved and we've heard feedback from clients and intended parents, we definitely take in mind how you want to see the information and how you want to present it. So our profile structure has evolved over time, so that information is all available for all donors. So if you have any individual questions, please make sure to give us a call or shoot us an email, and we can have a dedicated case manager help walk you through some of those profiles to show you where you can find that information, because I promise you it's there.
All right, with that said, I do think that when you first sign on for the first time onto the database, it can be overwhelming. We range about 250 to 300 donors at any given time. And my first recommendation is give yourself time and enjoy the process. When I used to speak with intended parents, we would give the donors nicknames to remember them. So Lindsay, you remember the marine biologist?
Mm-hmm.
She was with a penguin. So that was like the marker. Everybody, when they asked for her, we were like, yeah, that's the girl with the penguin. So have fun with it. Definitely, if you're looking at donors, perhaps you're doing it with a family member or your significant other, take your time and identify what's the most important things, rank them from top to bottom. So when I think about it, if I needed a donor, I'd definitely be looking at a Latina with curly hair and probably a little taller because I'm short. But those are my top three, of course. And then I'd be looking at other things such as, does the donor like to hike? What's important to me? And I think that's very personal. And within your wish list, do know that sometimes you'll have to compromise. And again, that's why I say rank it from top to bottom. And also look for the potentials. We have some donors that are highly educated and some that started college and put a pause to it. And I would say sometimes it's because they started parenthood early and that put a pause to their education. And
Or some of them are supporting themselves, so they, take breaks in between some of their semesters or some of their courses so that they can make a responsible financial decision.
So that comes back to take a look at their motivations and try to connect and see what was this donor's potential. And one thing I'll also say is when we look at the donors' profiles, I think, self-reflection on me, everyone, there are imperfections. You're not going to find the perfect profile, but you will find the right donor, the one you connect with. And the last tip I would say is the donor blood type is not medically necessary unless, and I will say this, if you decide not to disclose to your child, then blood type could be important to you. But from a medical standpoint, it is not.
Great tips.
All right, well, why choose frozen donor eggs? So I'm gonna send it over to Olivia.
All right, thank you to you both so much for all of that wonderful information.
Thank you.
All right, why choose frozen donor egg? Of course, there are many advantages to using frozen donor eggs. With each egg lot, you will receive 5 to 8 mature eggs, and they've already been frozen, they've already been retrieved, frozen, and ready to ship. So there's no need to worry about synchronization with the donor. And there's no chance that a donor will drop out during the process or maybe make a mistake taking their medications because those eggs have already been retrieved. There is a much wider donor selection when you choose frozen donor eggs, and there's much more control of the cycle timing. So you can really move forward with the cycle when it's most convenient for you, which is just an added bonus for surrogates as well. And lastly, frozen donor eggs are overall less expensive than fresh. Here at Donor Egg Bank USA, we like to be very transparent about our statistics and our outcomes. So I just like to highlight a couple of things here as far as, how successful are really frozen donor eggs. The clinical pregnancy rate there is about 61% from 2020. And, of course, the reason that you're choosing frozen donor eggs is for the result, and the result is to bring home a baby. So of course, piloting that statistic at the bottom there, the ongoing and live birth rate per embryo transfer being 53% and per initiated cycle being 46%. As I said, we are really transparent and we always share our statistics with not only our clinics that we work with, but the clients as well. So if you ever have any questions, please feel free to ask us. And now going into more detail about our different financial options. So for the single egg lot plan, it's just as it sounds. You're paying $14,500 for one egg lot of 5 to 8 eggs. And this is coming with a guarantee of 1 or more blastocyst embryos. If that guarantee is not met, meaning that the egg lot does not result in a good quality blastocyst, then we will be replacing the egg lot free of charge. And the treatment to your fertility practice is paid separately. So you are paying the $14,500 for the egg lot and paying your clinic for the cost of treatment services. With the double egg lot plan, you will be receiving 2 egg lots of 5 to 8 eggs, and the cost of this one is $27,500. So you can see there's a significant discount on that second egg lot. The guarantee with the double egg lot plan is 2 or more blastocyst embryos. And similar to the single egg lot, you are paying the cost of treatment to your fertility practice separately. With the single cycle plan, this is a one-time attempt in which the services are packaged into one payment. So you're making a one-time payment up front, and that is inclusive of the egg lot and of the treatment services at your clinic. And the cost of treatment is actually reduced in this plan. This also is guaranteeing one or more blastocyst embryos, but unique to this plan that separates it from the single egg lot plan is that you're also guaranteeing one treatment cycle as well. So for example, if you choose the single cycle plan and in the unfortunate situation that there is no good quality blastocyst in that egg lot, we will replace the egg lot free of charge, and you don't need to pay again for that next treatment cycle because you've already paid that cost up front. Prices do vary by fertility clinic for this plan. So if you contact us, we are more than happy to provide you with a specific price point for your clinic. And then our assured refund plan, which is by far our most popular plan. And this is our live birth guarantee program. So this plan is offering up to 6 treatment cycles, and they're all covered in a one-time fee upfront. This is also including a unlimited amount of frozen embryo transfers. And if at the end of this program, if you go through all 6 cycles and the additional frozen embryo transfers and you do not bring home a baby, you will be getting 100% of your money back from Donor Egg Bank USA. So there is zero financial risk to you as the patient whatsoever. If at any point you choose to leave the plan on your own accord for various reasons, you will receive 50% of your money back. Again, for this program, prices do vary by fertility practice, but similar to single cycle, you will be paying one fee upfront, and that's going to be inclusive of those up to 6 egg lots and the cost of treatment cycles from, or treatment services from your clinic, as well as those unlimited frozen embryo transfers. Important to note with this plan is that you do need to apply to qualify, although I will say it's a very simple process. And 95% of patients, of our clients who do apply will qualify. And of those who qualify, 92% end up bringing home a baby. Our multi-egg lot refund plan is designed for those who have insurance coverage for treatment services or who are patients at clinics that don't offer the assured refund plan. It is similar in some ways to the assured refund plan in that it is also guaranteeing a baby. However, this plan only offers up to 4 egg lots, and the cost is $30,000. I will say, I want to emphasize the cost is $30,000 only for those up to 4 egg lots. You as a client are still paying separately for all of those treatment services at your clinic. Similar to the assured refund program, you will be receiving 100% of your money back if you do not bring home a baby after those up to 4 egg lots, and 50% of your money back if you decide to leave the program. So just want to reiterate, this is a great program for individuals who do have insurance coverage for those treatment cycles so that they can take advantage of that benefit. And I like to point out that we offer this wonderful bonus through our partnership with Cord Blood Registry, and that is free cord blood and tissue processing to all of our patients. We strongly believe in the benefits of newborn stem cell storage, especially for donor-conceived children, so we love to offer this bonus to you all. And this does include storage charges that are covered for up to the first year. So that concludes our presentation today. Registering is very simple. You just go to www.donoreggbankusa.com. You can do it tonight still, and we do have case managers available until 9 p.m. Eastern time tonight. So you can either go online and register or call that phone number or email us. And we are available tonight, like I said, until 9, and of course during business hours during the day. And once you do register, you will be paired up with a dedicated case manager who can also walk you through all of these financial options that I walked you through tonight. So they're happy to provide that information as well.
All right, so thank you everyone for joining. It looks like we have a couple of questions, so we have several minutes here. I'm gonna ask the first one. What is the determining factor whether 5 or 8 mature eggs are provided?
So it's a great question. It's a little bit complicated, but the easy answer is that every body is a little bit different and every donor produces a different number of mature eggs. So we have our own specially designed algorithm so that we can, no matter what number of mature eggs that donor produces, that we can break that up into the egg lots for our clients. And something really important to remember is to not hyper focus on that number of whether it's 5 eggs or 8 eggs, because regardless of that egg lot size, you're always going to get that embryo or that blastocyst guarantee.
All right, next question. It says, does it matter with the age? Does it matter the age of the intended receiver, the intended parent? Well, in this case, I do know it varies on the policy of each fertility clinic. So depending on where you are, I do recommend that you ask your fertility clinic.
I see another great question. I think, Margarita, this would be a great one for you. What's the difference between the pregnancy and clinical pregnancy rates?
Great question. So, and what's the difference? Well, to be a positive pregnancy is based on your first beta, but a clinical pregnancy is when there is a fetal heartbeat or a fetal sac in an ultrasound. So do you want to flip back, Olivia? I think you touched on the...
Which one would you like me to go to?
On the success, the stats?
Yes.
Success rates. Yeah, I think this is important just to stand out. I know everyone, when we come to, when our clients come to Donor Egg Bank USA, the goal is to get pregnant. And our goal is for you to have your baby. And it's important for us to be transparent. So we do give you the differences. After miscarriages, the ongoing rate and live birth rate per embryo transfer is 53%.
I do see one question. Who do we contact to determine the price for your clinic? That would be your case manager. So if you call that phone number at the end here, which I'll go back to, or email them, or if you register on the website, they can very quickly find out for you how much the program is.
I see a great question about having some eggs in storage, but possibly needing 4 additional eggs, or possibly maybe 4 to 5. We do have standard egg lots that are 5 to 8 eggs, and those are part of our financial plans. But our goal is to always help every intended parent achieve their goals. So I would encourage you, give us a call, get in touch with a case manager, and we'll see what options we have available for you.
I am seeing a few questions about providing a list of fertility clinics that we work with. If you go to our website there and you put in your location, there actually is a full list of all the clinics that we work with. However, if you don't want to do it that way, or you are curious about a different location, or maybe a clinic that's not even on that list, go ahead and give us a call and let us know where you would like to be seen, and we can see if we do have a relationship with them, and if not, if we're able to establish a partnership and ship eggs to their clinic.
I do see one question that I may have missed earlier that asked about drug testing of the donors. I may have gotten a little ahead of myself and skipped right over that part of the screening slide, but the donors, all donors do complete a drug screening panel prior to beginning their cycle. So that is a standard part of the donor eligibility process. Great question. Olivia, I see one good question here. Our insurance covers many fertility treatments. Do you do claims with our insurance on the assured refund plan? That may be a good opportunity to talk about that multi-egg.
Yes, exactly. So with the multi-egg lot program, well, I will say initially with the insurance claim, we don't work directly with insurance companies, but we have in the past have had had clients use their super bill or their bill of costs from Donor Egg Bank to see if they can get coverage from reimbursement from their insurance, but we do not work directly with insurance companies. The multi-egg lot refund plan was designed for those patients who do have who do want that live birth guarantee, similar to the assured refund plan, but can use their insurance for some or all of those cost of treatment services. So, as I'm sure many of you are aware, it is difficult to find insurance coverage. So the multi-egg lot refund plan is a great opportunity if you are one of the few who have that opportunity and want to use that towards the cost of treatment services. I hope that answers the question.
right, I see another question that says, when you mention good quality, does that mean blastocysts are PGTA tested or just make to day 5 or 6 blastocysts?
I'm sorry, I'm not, it's a full list of
So
questions
when
right
it
now.
comes to our guarantee, when we say a quality, we refer to a blastocyst either for freeze or biopsy. We do not guarantee a euploidy embryo.
Mhm.
But you do have riders that you can purchase separately, and I'm not sure if you mentioned that. I may have missed it. Did you discuss that within your presentation, Olivia?
We haven't gone over it this evening, but we do have a rider that you can, if you do choose to move forward with PGTA testing. That's an additional cost on top of the single or the double egg lot. And again, our case managers can give you more detailed information on that. But that's essentially guaranteeing you a euploid embryo using PGTA testing, and that offers you up to 3 egg lot opportunities to achieve that euploid. The cost of that is $4,800. But yes, I would say call and talk to a case manager, and they can
And
assist you
see if
with more
it's
detail.
available within your clinic. Yeah.
Yes. A couple more questions I'm seeing on case managers. One being, how do I know if I'm set up with the case manager? If you have already registered and you've gotten maybe a welcome email, but you haven't been reached out to by a case manager, please go ahead and give us a call or email us, and we'll make sure that you are assisted as soon as possible with the case manager if for some reason you weren't established with one in the first place. And then I did see a question about whether or not our counselors or case managers can help you select a donor. And we certainly can. If you want to give us information about what kind of donor you're looking for, certain qualities, attributes, things like that, we can help you search through our database and find one that's a good fit for you. When it comes to genetic testing compatibility, that's something that we do suggest that you talk to your physicians about as far as whether or not your intended donor is a good match with the sperm's genetic screening results.
I also saw a couple of questions regarding pricing for the Assured Refund Plan. As Olivia may have mentioned, it is specific to the clinic. So to give you the most accurate information, just give us a call or shoot us an email. Let us know, if you're already working with a fertility clinic, or if you don't have one yet, if you're in a specific region, we can certainly help direct you to one and give you that accurate information on the cost of that program.
I do see one question about the criteria for the Assured Refund Plan. So with that process, once you do let us know and let your clinic know that you do want to apply for the Assured Refund Program, we are going to work with your clinic using a medical evaluation form that kind of essentially gives us a good background idea of your medical history, your specifically OB history, as well as a semen analysis. What might disqualify you, your case manager can certainly give you some more details on that. But again, we'll look at the sperm parameters, we'll look at any history of recurrent miscarriages with frozen donor egg, or if there are any significant uterine factors, things like that. But we always suggest that your clinic works closely with our medical review team to make sure that if for any reason you might not qualify, that it's a very valid reason, because of course we want as many people to participate as possible.
I see a great answer here or a great question here for Margarita. The question is, when I'm searching for a donor, I sometimes get the message that there is a match for my search. However, the donors are not shown. Why is that?
The first question I would ask are you using many of the filters? Sometimes when we use too many filters, it actually does not show all the donors. I do recommend that you call us to see if it's a glitch or what it could be. I highly doubt it is, but if there is a specific criteria or donor that you're looking for, let us know. We're happy to have an eye out for you too, and give you a call when those donors come through to us.
Mm-hmm. And it also could possibly be if you're searching by a specific donor number, if that donor has been selected by another client, she may not appear for you if there are no available egg lots left.
Lindsay, Margarita, I have seen a few people ask for the ID disclosure. Can donors change their mind in the future?
That's a great question. So there is a California law that does state that donors are allowed to submit to us in writing if the donors would elect to change their mind. I'm going to kind of refer back to that anonymity and disclosure slide that Margarita covered earlier in the presentation. And you may have seen that 65% of the donors are selecting non-disclosure, and the other percentage are selecting the ID disclosure. So there are more at this time that are selecting non-disclosure. A huge part of that is that the donors are encouraged through their thorough consenting process in the clinic that if they are unsure if they would want to be ID disclosure, if they have any doubts or any reservations, that we want them to go on the conservative side and to select that non-disclosure, because we don't want them to set the expectation that they would be ID disclosure if they were to change their mind. So that's where you'll see that vast difference there. I think there was a supplemental question that kind of went along with that said, would that be retroactive? And so part of that law is that, yes, donors can submit in writing if they would like to change their mind about their disclosure level. And so we are always displaying the donor based off of her current selection. It's very rare for a donor to change her mind. And so, you may have noticed that vast difference that more donors are choosing that non-disclosure option, because we encourage them to be 100% sure before they go forward with ID disclosure.
All right, thank you, Lindsay. There's another question. It says, how often are new donor profiles added to our website? So this is very important to us. We try to add on a daily basis. Sometimes, I'll be honest, lately donors are getting snapped up pretty quickly. But in average, we're adding about 4 to 5, sometimes on a good day, 10 donors. Mm-hmm. When you see that donor alert email, that means there's probably more about 15 to 20 donors going up.
I do see one question that someone said, if we're hopeful for the potential of not just one child, but a possible full genetic sibling for the future as well, are there instances in which donors have more than one lot of eggs? If so, is there a way to see that in the database?
That's a fantastic question. And so we definitely just encourage you to be open with us. If that's your hope, we want to know about that plan. And we can always check to see if there are additional egg lots available. Keep you at the top of the list should that donor donate again. So the way that we can help you is by you making it clear to us as early as possible that you are hopeful for having multiple children and you may need an extra egg lot. So just keep us in the loop and we'll see what we can do for you.
I do see approximately how many donors do you have on your website? Lindsay and Margarita, you can probably speak more specifically than I can to that.
So it varies at any given time. Lately, we've been averaging about 250. It balances between 225, 250. On a good day, we're at 300. It really varies. I do feel that the movement has been quite busy on our website and donors are going down quickly. So if you did see a donor that didn't get a chance to select, or give us a call and let us know. We'll put you on a priority list for them. Mm-hmm.
And then I also see, how often are new donor profiles added to the website? That's a good question.
Daily and as often as we possibly can, but like Margarita said, sometimes we activate them and they get snatched up within moments. So we do our best to get them up as often as possible so you have as many choices. Again, if you're not seeing something that you're interested in, please pick up the phone, give us a call, send us an email. Give us some criteria. That's, what's your top 3 criteria? Are you looking for somebody who's your exact same height and freckles on the nose? Is that what's it for you? If so, we can keep an eye out and we can try and keep that in mind for any donors that we may be activating soon.
I do see a question that a lot of people are probably having in regards to reserving a donor. So if someone says, do we have to submit payment before reserving a donor? So can you guys speak to kind of the timing of that as far as when they select a donor and when payment is made?
Sure. So payment is not due at the time of your selection, but once you make that selection, you have expressed to us that you are ready to move forward with that donor. And we do initiate our agreement process, our financial agreement, the intended parent agreement, and get started on providing you with those instructions on how to complete payments. The standard is 5 business days, which is initiated at the time of that selection. We encourage you to keep in touch with us if you have any concerns about that timeline, but your selection is when we initiate that process. I think I saw a question that said, are there any donors that are not available on are there donors that are available that are not displayed on our website, which is another great question. So we make available donors as we can make them available to you. But again, I'm going to stress, if there's something very specific that you're looking for, or if you saw a donor 2 days ago that you really thought you connected with, but you just weren't ready to click that select button and now you feel like you've missed out, please let us know. Perhaps she's interested in donating again. Perhaps someone has selected that, but might not end up moving forward. Maybe they change their mind and pick a different donor. If you let us know, we can put you on the list. And if that match gets canceled before moving forward, we could certainly make you first in line for that donor when she's available. I see a question about donating extra eggs or extra male sperm to another couple. I'll kind of touch on that, and we could even expand it out to if you actually create embryos and have any left over. So that is a decision for yourself to make if you are in a situation where you have eggs, sperm, or embryos that are in excess of your need. For the donors, we always ask that you check in with us to make sure that the donor did consent that you could donate those eggs beyond your use. We're always happy to share a copy of the donor's agreement to participate in the program, which does state that she consented to that additional donation after the fact. Just something to keep in mind is that if you're going to donate beyond your use, we don't necessarily, as Donor Egg Bank USA, have a relationship with the individual that you're donating that to. So we wouldn't necessarily be providing the profile or the information that you received as our client. So just keep that in mind, that that's something that you would be navigating on how to share that information with the next intended parent that you are donating to.
I have another question that says, can you get multiple pregnancies from one egg lot? And yes, you can. We've seen plenty that have completed a family with one egg lot, but if you do plan to have more than one child, I do recommend that you at least inquire on securing a second egg lot for the future. We can't guarantee that you may, but I have seen that, yes, families have completed more than one pregnancy with an egg lot. And you can also check with your case manager and also look at the donor statistics and see if she has a proven track record before. We're not going to go into the details, but we'll tell you if she's been successful before.
I do see one question, is there a payment plan or should all money be paid up front? So Donor Egg Bank USA does not offer any payment plans as an entity. However, we do partner with some companies who do provide some financial assistance. That being said, when payment is due on our part, it is due in full. So there is no program where you pay in parts over time directly to Donor Egg Bank USA. All
right, so there's another question that came through. For egg lots, do you recommend to focus on a lot with more eggs? For example, 7 or 8 eggs over 5 or 6?
That's a great question. And so I'm always going to refer back to our blastocyst guarantee. Regardless of that number of eggs that's in that egg lot that you select, we stand behind the quality of those eggs and assure you that you're going to have that at least one embryo that you're able to transfer, freeze for a later transfer, freeze for a biopsy in pursuit of that pregnancy and that live birth. If you're considering a family and you want to have multiple children, some of our intended parents do lean towards or do prefer a larger egg lot. But all I can say is that every egg lot comes with that guarantee, and we've seen multiple births from an egg lot of 5, from an egg lot of 6, from an egg lot of 7, from an egg lot of 8.
It varies.
So I think the most important thing is if you find a donor that you connect with and she has 6 eggs, I think that that's more important than finding a donor that you don't connect with quite as well, but you're just going to pick her because she has 8 eggs. Go with what's most important to you.
Here's another question. It says, is it possible to have twins? How many embryos can be used at one time? So I think that's a personal question that you should ask your physician. The recommendation overall is 1 embryo to be transferred, just for the safety of the baby and the safety of mom as well. And I will say that I have seen embryos split before, but that's again a different conversation. So I do recommend bringing that over to your RE and ask that question.
I do see one question for the 2 of you. Do you provide results of psychological evaluation of the egg lots to the client?
So it's a great question. The copy of the psychological evaluation is not available to the client. All of the information that the donor provides during that is cross-referenced with all the family medical history and her profile information that has been provided to us and that is available to the client. But that conversation with the psychologist during that time can often be very identifying and very personal. The donor covers everything from her motivation, some of her personal family medical history, her reasons for wanting to donate. A big part of it is covering the consenting process. Has she had all of those questions that she has answered? Has she considered whether she wants to be an ID disclosure or a non-disclosure donor? If she has lingering questions about which of those anonymity statuses are right for her. So in summary, no, the copy is not made available to you, but all of the information that is collected during that evaluation is cross-referenced with that profile to be made available to you.
Yeah. And there's another question. What is the majority of the age regarding the ID disclosure of the donor? So it would be the age of 18.
I see one question here that says, as far as fertility, is an egg lot from a donor with who has already had a pregnancy or a birth be more successful? That's a great question. Do you want to take that, Margarita?
So I think
so just because a donor has had a child of her own, does that mean she's going to be a great donor over someone who hasn't had a child?
I think it's comfort level. She has proven fertility for herself. But if you don't see she has a child, you can always reach out and ask us, does she have proven fertility through other recipients? I will say again, too, for the first-time donors, at some point, all of the donors were a first-time donor. And we do stand by our quality and on a daily basis monitor how the results are doing. So definitely a good question. Reach out to us for more information if there's a donor that you're interested in.
All right, let's answer a couple more questions here.
All right, so here's a good question, Lindsay. I cannot seem to find much diversity in a donor. This person is specifically looking for a Middle Eastern donor. How do you increase the diversity to potential donors?
So our goal, and is to find a donor that every intended parent, every client can connect with on whatever is important to them, whether that's their ancestry, their ethnicity, their religion, their hair color, their interests. Sometimes we do have a hard time finding some donors or providing enough donors. What I can certainly suggest to you, if you're having a hard time finding a donor who is exactly what you're looking for, is really lean on that case manager. Reach out to them, let them know exactly what you're looking for. And we can keep you on the top of, keep you on a wish list. If we do have a donor that comes through to us who meets that criteria, we want to be able to make that available to you. And so by letting us know that's really what you're looking for and you're not finding it, can help us keep that radar going for you. And sometimes we do have a hard time finding enough donors of certain ethnicities or certain backgrounds. And so do you want to talk a bit about your experience?
So in my experience, when I do hear that, I definitely reach out to many of the agencies that we work with. From time to time, you'll see that some of the donors have a supplemental fee, and that's because we are working with an agency to increase that donor diversity. So again, I do welcome you to reach out to us for us to help you and put you on that wish list. And we will give you an update if we find a donor within your criteria.
Okay, I'd say one final question here. Can you see all of the available donors right from the get-go on your website, or do you need to register first?
So when you initially create an account, if you haven't, you will have access to donors that may be from every jurisdiction. If you haven't indicated, thank you. If you haven't indicated where you'll be receiving treatment, because I know Margarita referenced earlier in the presentation that there are certain areas or certain jurisdictions that have certain requirements for donors. So Canada, New York State, California, the state of Maryland. So you may see more donors that might be available to your jurisdiction to begin with when you initially create an account. So I highly recommend completing a full enrollment just to make sure that your account is set up so that you are only viewing the donors that are absolutely going to be available to you, so that you see donors that are perfect for you and available to your location.
Mm-hmm. And I will add to that too, that full enrollment might sound daunting, but it's really just us getting some good contact information for you. We're essentially going to get, the basics, your name, email, phone number, things like that. But we're also going to, if you've already chosen a clinic, we're going to get the name of that clinic and the physician and maybe the nurse that you work with, just so that we can really provide the best possible care and communication between everybody, and let them know, of course, which program you choose, and make sure that everything is happening in a timely manner.
One of the best things too, let's mention it, enrollment is free. It doesn't cost you anything. It's like going to the library. Just give us your information, and if you select a donor, the thing is, we do give you access to select a donor right there and then. And if you do select one, we'd love to know how to reach you.
Yes, I will say, so even though our case managers might not be working 24/7 on a day-to-day basis, you can select a donor 24/7. So that can happen anytime it's most convenient for you.
Wonderful. Well, thank you, Olivia, for inviting us.
Of course, thank you to you both so much for taking the time, and thank you everyone for joining us today. Of course, if you have any further questions, please feel free to go to our website, call that phone number, or give us an email. It doesn't have to be today. It can be whenever it's most convenient for you. We're here to help you and make sure that you feel fully informed throughout this process. All right, everyone, enjoy the rest of your evening. Thank you.
Okay, thank you, everyone.